And hello, everybody. Welcome back to the Dr. Mike and Shannon show. I'm Shannon Fanenstein, medical technology specialist representing Mazan Medical. And for those of you who are just joining us for the first time, we also have Dr. Mike Bradley. Dr. Mike, tell us briefly about yourself.
It's nice to meet you all. I'm Dr. Mike Bradley. I'm a PhD medical researcher. I'm out here in Las Vegas, Nevada. I work with the School of Medicine, several of the urology and urogynecology offices here in Las Vegas, and happy to be here talking with you.
Great, thank you. And thank you again for joining us. So we did a video already on 5 questions that women should ask when they are seeing their provider. What are common questions that men may be suffering in silence about that they should be asking their providers?
You know, the reason we keep getting into this topic is because of what we're dealing with pelvic floor issues. So that's embarrassing whether you're a woman, a man, a child, anything. When you're dealing with urinary control issues or fecal control issues, or with men or women, sexual function issues, those are the 3 most embarrassing conversations that we have with anyone. And for some reason, women are really good about not telling their doctor, not telling their husbands, maybe telling their best friend, but that's as far as it goes. And their best friend laughs and says, "Yeah, I have that problem too." With men, it's even worse because we don't tell it to no one, and that's how us men are when
it's not manly.
Yeah, it's not macho. It's not, it's that's, you're supposed to keep those kind of things.
I don't pee my pants.
Right. And the funny thing, and with men too, it's also control, because let's face it, continence means, or incontinence means out of control. Continence means control. And for a man, the loss of control, wow, that's hard, right? So it's tough enough to get a guy to go to the doctor anyway. My recommendation, wives out there, girlfriends out there, if you get your man to go to the doctor, let's make sure that every one of those appointments, you're taking the bull by the horns and you're asking every question that should be asked, and taking full advantage of that provider's time to fix all the little things that might be going on that, as you said, men are suffering in silence with. So that's what we're going to talk about a little bit today. And so I have a questionnaire that we hand out to our patients. We did this for our male patients when we worked in urology. And let's talk about it a little bit. One of the first questions that I ask people, very first, whether female or male, is how many times are you getting up at night to go to the bathroom? Very first question. Are you getting up more than once? Because if you are, guess what? That is a symptom. That's a symptom. It's urinary frequency, nighttime frequency, right? That is something that we can fix. Your medical provider can fix for you. And the reason I make that the number one thing there is like we've talked about in the past, that the number one killer of people is lack of sleep. Women out there that have men that are grumpy all the time, maybe it's because of lack of sleep. Well, is it possible that they're not sleeping well because they're getting up to use the bathroom? So when we look at quality of life, that's a great question to ask your doctor. Hey, doc, I'm getting up 3 times a night to go to the bathroom. What should I do? What should I, how can I fix that? And they've got options. There's things out there that we can do to help get you to sleep through the night. Okay. So that's question number 1. Let's go with question number 2. And this is an interesting one. I always ask them in this question. After we call it void, but after you pee, I'm going to keep it all real low level here, right? After you pee and you pull up your underwear, wives, does a little spot reappear in the front of that underwear? There's a little spot appear, right?
I thought dribbling was normal.
Yeah, right. Well, guess what? When you're dribbling, you've got a little bit of dribble that has a tendency to appear. Wives hate that, right? But at a certain point, it gets so bad that it actually goes through your jeans too. And guess what? Yeah, that's visible. Some men know exactly what I'm talking about. All of a sudden, they're looking for thicker underwear and that kind of stuff. And before you know it, you're looking at that one aisle at the grocery store that none of us want to ever go down, right?
Right.
when you
Oh, I'm
first
buying it for my wife.
right. Well, yeah, the extra, super extra large. But when you see that, that's a sign, it's a symptom of something, and it's something that's worthy of a conversation with your doctor about. You should, and you shouldn't be embarrassed, because believe it or not, that happens to a lot of guys, young, old, and a lot of times it's because of that pudendal nerve that we talked about, that lower back issues cause these kind of things with the bladder. And it's something that should be addressed. Why?
It's
Because
happening where women, we talk about it and we just think it's normal, and they advertise towards us. Men don't talk about it at all, so they don't have no idea it's normal.
right, and they hide it from
Right.
everybody. But wives know this stuff. They know.
Or girlfriends.
Right. And husbands or boyfriends, or even a single guy that's happening to,
Right.
should
Right.
address it. It's a good conversation to have with your doctor. All right. How about the third one? Urgency. Like, do you have a situation, guy, friend, buddy, when you're driving along and it hits you and you got to find the closest bathroom? I've seen guys pull off and find trees before.
Yeah.
You know what I'm saying? That they don't have the time to find the bathroom. They got to get to one. They got to get to one. We address this with women all
Which
the
is nice. A guy can do that. Women, not so much.
we've got the advantage of aiming and directing and that kind of stuff. But the reality is if you're driving along and something hits you all of a sudden, you have to have the bathroom, that's a sign of something, right? And it's something that's worthy of a conversation. Again, when we talk about the bulbar cavernosa reflex and one of the tests that we do at Mazan, or with that Urival system that we have, it's a way of testing that part of the body, the nerve, to see if it's firing correctly. And the symptoms that you can have based on, believe it or not, a lower back injury can be tied to the things that we're talking about today. So believe it or not, it may not be bladder cancer or urinary problems. It might be your lower back, which every guy knows when they have lower back issues. They know, right? So that's number 3. What are we up to? Number 4. Let's talk about number 4. Do you ever have that that leaking situation, the little dribble that happens after you've done some type of exercise? So some men, women, we know this happens. We joke about it with like their CrossFit and their exercise, but men can have this too, where they lift heavy things and they notice a little bit of wetness down in their underwear area. It's just a sign of something that can be absolutely fixed. It's nothing to necessarily worry about. It's something worthy of a conversation, because guess what? If you don't fix it, that problem, even though it may not destroy your world, it will constantly be there with you. It won't fix itself, right? And we want
And could get worse.
Yeah, it could. Yeah, absolutely. It does with a lot. It's a sign of, weakness that occurs. And usually it takes, with most of our patients, it's between 4 and 5 years after injury before we see these things start to show up as symptoms. So it's a long period of time. And then another 5 years, it's double worse of what it was the 5 years previous. So if
Wow, all those football players, if you're an NFL player watching, let's
absolutely,
go get tested.
Yeah, absolutely.
Get screened.
And like I said, you're screening for the nerve. We're checking the nerve in an area that's important. It affects so much of our lives. And it even gets to our 5th and final question, and that's sexual function. Now, this is the one topic of conversation that guys probably will talk to their doctor about, but are you having trouble getting an erection, holding an erection, keeping an erection? All of us guys, let's face it, when we were younger, and I'll speak to this openly, it was a cool breeze that would go by. And that's
Yes.
we would wake up every morning of our lives,
Yep.
say, Mom, don't come in, and have to run to the bathroom and that kind of thing. That's how we used to be. And the only reason we changed, a lot of people think that it's because, we control it better, we get used to it. It's probably that our nerves have calmed down a little bit, but our nerves can also get too calm, if you will, or be damaged, right? And then that erectile situation starts to happen with us. But it's amazing to me, guys will come in with the erectile dysfunction conversation, and then after I start treating them a little bit, all of a sudden I start hearing about all these other little problems. Well, guy, if you have the little dot happening in the front of your underwear, and you're not having an ED problem, you may want to get that fixed, because remember how I talked about every 5 years, you see this these new symptoms or an increased aggregate of the symptoms, you could be headed toward that direction. So if you fix it now, you may not have an ED issue later on in life. So that's why I think that those 4 questions that I said that came to the 5th question, which is the one that men will ask, makes an awful lot of sense to have those conversations early and often and regular, and go visit your doctor on a yearly basis at least.
And these were great and very enlightening questions for our men out there to be able to ask their provider. We do not offer medical advice. We just want to be able to, or we're not going to tell you how you should be treated, but we do want to provide you a way to be able to, have things to think about when you are talking to, and get those, 10, 15 minutes in front of your provider, and all of a sudden you go blank, like a deer in the headlights. I forgot what I was going to ask. And we hope that these will be able to help you and be able to have that conversation with your significant other, with your provider. And, we really appreciate your time. Dr. Mike, really appreciate your time. And if you're a provider and you'd like more information about the Uravel BRS, we have a link that is in our description. And if you are watching, please be sure to like, subscribe, and share our videos so that way we can continue to put content out there that will be able to help you, maybe a loved one of yours be able to get the help that they need. We thank you very much. Dr. Mike, anything else that you'd like to add?
I just think that the best advocate you'll ever have is either yourself or that person who really loves you. So listen to them.
And thank you again for watching.